Munnayuganda munnaffe asobola okwogera ennimi zonna naye ntegeezeddwako nti abasinga obungi kuno tebawulira Luganda. Naye nga dokita ayogera ennimi zonna, Oluganda, Lunyankole n'Oluzungu, asobola otunnyonnyola naye ng'ekisooka dokita lwaki mwagala okutusaanyaawo fe abaddugavu nga muyita mu kutugema eddagala erya COVID-19. I think you can take it up from there. Thank you.
Okay. Thank you very much, Mr. Chiaga, for inviting me to speak today. Thank you everyone who is participating in this talk. And thanks to the clergy. Omsumbwa Lincoln was really good, shared with us his experience with COVID-19. So Mr. Chiaga approached me a few days ago and, like he said, asked me to come and talk about the vaccine, especially because our Black community are quite hesitant to take it on. There's been a few conspiracy theories and myths. So my role today is to try and talk about what I know about the vaccine, why I think we should take it on. So we started the vaccinations here in the UK last month in December. And as you're well aware, there's a criteria. So we had to start with the 85s and above, those in care homes, and then healthcare workers, over 75s, and those who are high risk. So the idea is that we will keep rolling it out, and eventually the final group that we have are the over 50s and those with underlying medical conditions. So I'm just going to share a quick PowerPoint presentation. He's asked me to keep it brief because we need to do a few questions at the end, and I do hope that I can address everyone's question. Okay, so I'll start with a brief background, which Mr. Chiaga has already done most of it. I am Ugandan. I'm not trying to wipe out our people. I graduated with my degree in medicine and bachelor's degree in surgery in 2007 from Makerere University. And I'm a GP now in Kent. I work in Ashford. Like he said, we've been doing the vaccination since December and it's going really well. So the first thing that I'm going to talk about is why I feel it's important for us to get this vaccine when we're invited to come in for it. First of all, this COVID-19 has presented a global pandemic. You know, there's been over 100 million cases of it and up to 2 million deaths from this disease. The preacher Musumba Kasivye told us his personal experience. People have ended up in intensive care. Others have lost their businesses. You know, we are locked down. It's just really affected so many people, a lot more than we'd anticipated. The other thing is, with the younger people, they think that they cannot catch COVID. They think it's only killing the elderly or those with underlying medical issues. But actually what happens is, if you're young, you might not have symptoms, and then you could spread it to your loved ones, to your grandparents who will die, or even your parents. So it's really important that we have the vaccine, not just to protect ourselves, but to protect those around us. So this is just a brief explanation of how vaccines work generally. This is a live virus. I will say that. They don't put the live virus in your body. They get a part of the virus and take a cell, well, part of its genetic coding out, or what we will call the RNA. I'm trying to keep it very in lay terms. So it's a weakened form of the virus that we use. It gets injected into your body. The body identifies it as something foreign, a foreign invader. So how the body responds is it releases antibodies, which we call soldiers, that come to attack this foreign invader to protect you. But it also releases memory cells, which is I will call it a reserve army that would come into play in future, and I will explain this. So once you've had the vaccine, you get these antibodies which would fight the virus, but you also get these memory cells. How do these memory cells work? In future, if you do get exposed to COVID-19, the memory cells come up and they form you get the antibodies again. So what happens is, although there is a chance that you might catch the COVID-19 in future, although you've been vaccinated, you are less likely to get a severe form of it. So you wouldn't end up in intensive care, you wouldn't end up dying, you might not even get any symptoms at all. So it reduces the chance of you having to suffer from the COVID-19 disease. Now, these vaccines, they've been clinical trials done, they've been tested. Every vaccine is put through rigorous testing because we need to ensure that it's actually safe to be used. And not just that, it also has to demonstrate that it is efficient in protecting you from COVID-19. So at the moment, there's about maybe 270 COVID-19 vaccines that are being trialed and tested. And even the ones that have been rolled out already, the studies are still ongoing just to monitor and make sure that they are safe. So like I said, there's no 100% protection from any vaccine, but at least you have better chances of not dying from the disease if you were to catch it. So it does because of the less severe type of infection. So with the vaccine, at the moment in the United Kingdom, we started with Pfizer, and we're now also doing the AstraZeneca Oxford COVID-19 vaccine. So these are the two that have been approved in this country. They both work pretty similar. They are both quite safe and effective. So when you get invited in for the vaccine, we give it in your arm. It's a very small amount, about 0.5 mils that's injected into your arm. When you've had the first dose, your body starts to form those antibodies, the soldiers that I talked about. And within 3 weeks from when you've had your first dose, you have about 50 to 70% protection from COVID-19. We then invite you back in about 3 to 12 weeks for a second dosage. And once you've had the second dosage, it's meant to give you up to 90% protection, and it's lifelong. So what that means is if you were to get exposed to COVID-19 virus in future, after you've had your second dose, there's a 9 out of 10 chance you will not get any infection at all. There's only a 1 in 10 chance that you might get an infection. But if you do, it's going to be a less severe form of infection. So less risk of being admitted or even dying. So the main question today is this vaccine safe? This is what everyone wants to know. I would say I think it's safe because each of these vaccines have been tested. There's been over 20,000 people in each clinical trial. So these clinical trials, they're randomly selected. They involve a wide range of the population. So they get people from different backgrounds, ethnicities, different age groups, different lifestyle and health issues. And then they would divide them into half. So half will get the vaccine and half will get what we call a placebo. So like a fake, they would think they've got the vaccine, but they won't have got it. So these people are followed up over time. They have tests done to make sure, just to check and see who's formed the antibodies and who hasn't. And then they are followed up to see who would catch the infection. They're also obviously followed up to make sure that they remain safe and no one's had any side effects or any problems from the vaccine. So the ones that have been released have been tested and found to be safe. The other thing that most people have been worried about is that this vaccine is going to alter their DNA. So, like I said, this vaccine, it's not a live virus. It's not a live vaccine. It's a weakened form of the virus. There is no way that it can multiply in your body or in your cells. There's no way it can make other copies of itself. So I don't think that it could alter your DNA based on that. Then there's other people stating that they've had or their relatives have had the COVID-19 vaccine and then actually developed the COVID-19 following that. Yes, this is true. I've had a few cases, about 3 people, but what the research thinks is these people possibly had already been exposed to COVID-19, but because they were still in that incubation period when they came in to have their vaccine, they didn't present with any symptoms at that time. And then after they've had their vaccine, they've gone through their incubation period and now the symptoms have presented. So that's what's happened in these very few cases. But it's not that they could catch COVID from the vaccine. Right. I
have Australia who tested and their people presented HIV.
So the other issue that's been coming up is the pig product. And this has commonly been, it's a concern obviously to our Muslim and I think Jewish brothers and sisters. So what happens is we use something called porcine gelatin. This is from pig, fish, or chicken. And what we use this for is to stabilize vaccines whilst they're in storage. So it keeps them safe, it keeps them from breaking down and make sure that they remain efficient. So in the UK, there's, I think, 3 vaccines that we use this gelatin in, which is the MMR that we give for the mumps, measles, and rubella, the one that we give for shingles in the elderly, and then the children nasal flu vaccine. Those have that porcine gelatin. Pfizer and AstraZeneca have said that they do not put any pork gelatin in their COVID-19 vaccine. So hopefully that shouldn't be a concern. Right. So the other issue that people are concerned about is if they will have any side effects. Yes, there are chances of having side effects, but most of these are very short-lived, within 48 hours of having the vaccine. And the common ones are, pain at the site of injection. Sometimes people feel a bit unwell, flu-like, with aches and pains, fevers and chills. And so when you get the vaccine, we will always advise you to make sure that if these come up, you can take some paracetamol and they should ease off. Obviously, if they are lasting longer or dragging on, then you might need to see your GP to make sure you haven't got anything else underlying, like, another infection. Okay, I also want to talk about a few special groups. So with this, the national program, it's strictly by invitation. And like I said, there's a criteria. We start with the most vulnerable, working our way down to the general public. However, there are a few special groups that we're having to consider. So patients who are about to start treatment that might weaken their immune system. This includes people with cancer who are going to start chemotherapy, or people with autoimmune diseases, rheumatoid arthritis, who need to take medications that would weaken their immune system. sometimes we prioritize them. So although they might be younger than other patients, we would try and call them in and try and give them the vaccine. And that's just to make sure that they are safe and protected before they start their treatment. Because we know if they were to catch COVID, they most likely might not make it or have a very severe form of infection. The other group I wanted to talk about is with the HIV. The guidelines say that we can give it in HIV, but they are not a priority group. It doesn't matter what the CD4 count is. They would have to come in when they are called in with the rest of their group. So if we're doing the 75s and over, then that's when they would come in for the vaccine. And the last group that I thought to talk about is the pregnancy. So the advice has been to try and avoid giving it in pregnancy. This is not because there's any issues with, it's not causing any safety concerns or harm to pregnant women, but it's only because there's insufficient evidence in pregnancy. So we've not had enough numbers studied. Having said that, there's been a few people that have become pregnant after having had the vaccine, and there hasn't been any problems to them or to their children, to the babies. So although it seems safe at the moment, we're still holding off until we've got enough numbers to confirm that we can indeed give it safely in pregnancy. So before we start our Q&A, I'm just going to quickly touch on a few things, like if you've had anaphylaxis. What this means is if you've ever had maybe a bee sting or taken medication and you ended up fainting, losing consciousness, so we call it anaphylaxis, then we would recommend that you don't get the Pfizer vaccine. There's been 2 recorded cases of anaphylaxis. So anyone who's ever had any sort of anaphylactic reaction, we are opting for them to have the AstraZeneca because there's no recorded anaphylaxis from this one. People who are called in to have the Pfizer vaccine, we would observe you for at least 15 minutes after you've had your shot, just to make sure you're okay. But if it's with the AstraZeneca, we don't have to observe at all. Once you've had it, then you can go home. We only advise not to drive for 15 minutes after. Yeah, and then I think there's been another conspiracy theory about microchipping. So I really don't know how this would be done, but so the vial of the vaccine, each of them has about maybe 5 mils, and we can draw up to 11 doses in each vial. So 11 different patients would get a vaccine from the same vial. I'm not really sure how a microchip would go in there and get divided into 11 doses. I don't think it's possible. Yeah, but most of these conspiracy theories are on social media. They are not backed up by science or research, but this vaccine the vaccines that, are rolled out have to be tested. They have to be approved by the MHRA, which is, the Medicine and Health Regulatory Agency. Before they are rolled out, they have to be considered safe. And then, everyone else, like the Queen's had it, and she's okay. Yeah, so I think it should be safe for everyone else to have. So that's my brief talk. I don't know how many minutes we have, but Mr. Chiaga had said we could have a Q&A session. If there's any questions.
Okay, thank you very much, Dr. Gloria, for such a wonderful presentation. Which has covered the ground.
Mr. Chiaga, I have a question, please.
Yes, we are going now for the question and answer session. Should we take about 5 questions and then you answer them at a go?
Okay.
If you can get your pen ready and a paper, and then just introduce yourself and where you're calling from, and then ask a question, and then the doctor will answer after the first session. May I know who raised their hand first?
Sylvia Musoni.
Yes, Omulangira. Oh, okay, Sylvia first, then Omulangira, Nomuzana, and then we shall go from there. We have Elizabeth, number 3. You unmute yourself and ask Sylvia Musoni first.
Mujabi Asha.
Mujabi number 5. Let the doctor first answer those 5 set, and then we shall come back to another set. So can we have those 5 in that order? Sylvia?
Okay. Good evening, everyone. My question is about children with special needs, any children with genetic issues, and if they have anything like congenital heart diseases, because under the government, they are regarded as clinically vulnerable. When will they be able to have the vaccination?
Okay. Okay, thank you very much. Muzana, your question has been noted.
Thank you very much, Doctor. Good evening, everybody. My name is Rita Mawanda, aka Omuzana Wamlangira Mawanda.
Yes. Go on.
Anyway, I've got 2 very simple questions. I had my vaccine on the 13th of this month, and I don't know if it's me, but I'm a little bit worried that I did not get any, any after effects, any after symptoms whatsoever. Everybody who had one at work at least had a headache or cold feet or something. I don't know if that means anything regarding the immunity. And the other question I would like to ask that normally they say on average it takes about 18 to 24 months for a vaccine to come out and is safe for use. I don't know if it sounds weird, but probably why is it that this one has come out? I know it's a bit urgent, but probably it's why people are really wondering whether it's safe or not. It's come out really quick, less than 18 months.
Okay, thank you, Muzana. Can we now move on to Muchala Elizabeth Sekweyama from Queen?
Yeah, hello, good afternoon. Hello, Gloria, good afternoon. Mine is just a simple question. When I come to your surgery, do I have a choice of having a Pfizer or having an Oxford vaccine? Do I have a choice? Thank you.
Thank you, Muchala Elizabeth. We have Asha Mujabi from Sweden, number 4. And then we shall have one more question.
My question is also simple. I just want to know the difference between the 2 vaccines. Why do we have to take Pfizer and then take the other? Can someone have a choice of taking one at a go? Thank you.
Okay. Yeah, we shall have one more question. Anybody? Reverend Chris, did you want to ask?
I wanted to ask.
Okay.
Yeah, I want to ask.
Okay. I'll come to you, Sylvia, on the second set. Sorry. Can we have Reverend Chris Obua ask the last,
Thank you. Good evening, Doctor, and good evening, everybody. My question is, people are saying that vaccine which they are taking to Africa, there is something within the vaccine they're put there so that they can vaccinate. Like people have read with the vaccine of Bill Gates. What do you say about it? Thank you.
Okay, thank you very much. Can we now have Dr. Gloria
Yes.
respond to those 5 set of questions? and then we can have another set after that. Thank you.
Okay, thank you so much for those questions. So I will try my best to answer them. So the first one was children. You asked about the young children with underlying health issues, when they would have it. So first of all, with the AstraZeneca, you cannot have it if you're under the age of 18, but the Pfizer you can have if you're 16 and above. So on the program, when we finish the 65s and above, we are going to invite in 16-year-olds to 60, 16 to 64 who have underlying health issues that would put them at a higher risk of getting a more severe form of the COVID disease or even dying from it. So the children will get invited at that point after the 65s.
Wow, that's good to know, because mine is below 16 and I've been asking about vaccination.
Yeah, so under 16, they're not going to give it to your child. I think they will wait until he's 16, and hopefully by then the studies will have been concluded on the younger age groups. But at the moment, we're not doing under 16.
Oh, thank you.
Okay.
Thank you. That's good.
That's okay. Then the other one was Sylvia. I think you asked about, you had it on the 13th of January and you've not had any symptoms.
No,
So,
the younger one was Sylvia.
No,
The one you've just
Rosanna.
answered, it was Sylvia.
That was me. That was Rita.
Yeah,
Let us give the
Rita.
let us give her a chance to answer.
So the Rita who did not get any symptoms. So the symptoms are a sign of an immune response, or your body, trying to fight this foreigner that has entered you. So not everyone gets the symptoms. I will say that I had mine and I didn't have any symptoms at all. My husband had his and he was in bed the whole weekend. So I think people respond differently. It's the same thing with the virus itself and the COVID-19 disease. There are people who've had it and did not have any symptoms, but only knew they had it because they had a positive test. And yet someone else in their household ended up in ITU or dying. So our bodies respond differently. We have different immune systems. The fact that you've not had any symptom, you shouldn't worry. When you get your second dosage, Rita, you'll definitely have your 90% protection. Okay. Then the other question was about, should you have a choice between Pfizer? So what's happening is, personally, my surgery, it's quite rural, and obviously most of the patients have been opting to have the AstraZeneca Oxford one, homegrown. However, you can choose. You can choose when your GP invites you in. The thing is, with the Pfizer, we had issues with supply.
Yeah.
So if you want that, you might not be able to get it for a while, and that means you'd have to wait longer. The AstraZeneca came out later. However, they were able to give us a lot more doses. So at the moment, that's what most people have been receiving. But you do have a choice, and you would get, you have to consent to get the vaccine. So not everyone will, you're not forced to have it. You have to consent to it. Then the other question was, why would you need to have the two? So just to clarify, you cannot have the two of them together. So if you get your first dose as a Pfizer one, your second dose has to be Pfizer as well. So you get that complete protection and your body can build the antibodies. If your first is an AstraZeneca, then your second one will be AstraZeneca as well. So actually, because of the supply issue we had with the Pfizer, the people who got Pfizer at the start, most of them haven't yet been able to get a second dose, some of them, whereas the people who had the AstraZeneca, some of them have been lucky enough to get their second dose already, but the government is trying to make sure that it gets enough supply. So everyone's second dose will be within the 3 to 12 weeks, which is recommended. Then there was a question about the trials taking 18 to 24 months, and this one taking a lot shorter. Yes, it has taken a shorter time to get this rolled out. Yes, first because of the extent of the pandemic, the urgency. So most clinical trials are done for vaccines are done in about 3 phases, where they first try it in a vector cell, so it might not be a human cell. Then if that's successful, then they'll try it on humans. Then the third phase, they just try and monitor. So all 3 phases are done one after the other, which is why it takes long. But with this one, because of the added all 3 phases at the same time. So I would say they did it parallel. It wasn't sequential. They did it all at the same time and were able to conclude that this is actually safe and efficient and it's working. So that's why it's rolled out quicker. But just to put your mind at ease, the clinical trials are still going on. They're still monitoring to look to see if there's any issues. But so far, there was no, it was 70% effectiveness documented and no adverse effects. Otherwise, it wouldn't have been passed by the MHRA. Then the question about Bill Gates' vaccine going to Africa, I don't know how to answer this because I'm not sure where these stories come from. I'm not sure if there's any vaccine going to Africa at the moment either. So I know that people have a lot of fear about these vaccines coming to Africa because in the past, I think there's been issues where substandard medical products were sent to Africa, like Nestle and that whole scandal of the contaminated formula, baby formula. So I don't know I don't really have an answer for that. I just hope that we'll have a safe vaccine being sent to Africa. But when the manufacturer is making this, they don't know which batch will go where. So I would hope that these rumors are false. I think they are false. They're conspiracy theories about everything and anything in life.
I think it is not false, but when you check out with the World Health Organization, Bill Gates has been in Nigeria for several times with vaccine, and we know this. And even here where I live in Denmark, many people are afraid with this vaccine, the 2 vaccine which has come now. So I don't know, but it is the real thing which is happening. Bill Gates has been there several times in Africa and people are afraid of this vaccine, but you're a doctor, you should have known that. Thank you.
Yes, so these conspiracy theories, I see them on YouTube and social media, but I've not met or interacted with a microbiologist or a scientist who would back them up. So my knowledge of that is a bit limited, unfortunately.
Okay.
Yeah.
It's difficult to wade into this because the truth is global businessmen travel all over the world multiple times. So the fact that Gates has been to Africa many times when he sends millions there anyway is not proof in itself that he is about to kill Africans. I'm just adding to the debate.
Thank you.
Thank you, Pastor Lincoln, for additional information. Ladies and gentlemen, we are now going to the second set. Thank you, Dr. Gloria. We are so privileged in this session to have other experts who are capable to support Dr. Gloria as well. Dr. Elijah Matovu is a microbiologist. If I'm not mistaken, he's also here. At a later stage, he will also come in to supplement. But the way we are going to move is now we are going to move on the second set of questions. And then Dr. Matovu, if he's ready, if you want to, to have a commentary, just to back up some of the answers, you are welcome. Maybe just 2 minutes, 3 minutes before you go to the next stage, Dr. Matovu, can you come on screen and say something?
Thank you very much, Mr. Mayanja. Can you hear me?
We can hear you, but we can't see you as yet. Yes, we can.
Sorry,
see
my
you.
apologies.
Yeah.
Just a couple comments. One is the simplest one of all is that the speed at which the vaccines have come up is not because there's a problem or there's a hurry or it's all business. One, we've got a problem that we urgently need to look into. And for that matter, governments have actually come up with funding, say, for example, Warp Speed in America, to find different vaccines, over about 217 ongoing at the moment in all parts of the world. So a lot of work has gone into this. Secondly, the coronavirus, as well as we know that's only been around for about a year, for what we know, it's always existed in the communities, not in the humans per se. So what's been happening when we had problems with SARS and MERS in 2003 and 2005, work had already started on coronaviruses as we know them. So that's in cells, in mice, in rabbits and so on. So with that information, it was only building onto what was safe for us to use. So when it came to coronavirus with a bit of funding and elsewhere, so there's a lot of work ongoing and hence picking up the different bits that we've got today and we're using. So from where we are, it is safe and it's not out there to catch Africans or blacks or whatever. I mean, in the past, we've had problems with, different bits of science done on humans and there have been problems, Tuskegee problems and the syphilis studies and so on that were done on our brothers and sisters. But this has been different. Everybody would understand why people are suspicious, but nobody's going to say, put vaccines into Africans for whatever reasons, or the Bill Gates systems. It's all a bit of conspiracy theories. I've had it, my family has had it, my parents have had it, they live down in London. It is safe and it's worthwhile protecting all of us. I don't know if that helps for a bit. I mean, there's a lot to talk about, but I think that's a good start. Thank you very much.
Thank you, Dr. Matovu. Can we go back now to Dr. Gloria and the next set of questions? I can see Sylvia Kalungi from Liverpool. And then we shall have Elizabeth P. I don't know where she's from. Just mute yourself so that we only leave one person who is answering questions or asking questions to speak. Then we have Rosemary Bagahi will be number 3. And then we shall have 2 more people. So Sylvia from Liverpool, Sylvia Kalungi, you have the floor.
Oh, thank you very much. I have a couple of questions. One is, what's the real difference between the efficacy of the Pfizer vaccine and the AstraZeneca vaccine? Obviously, as you said, that there is not enough available of the Pfizer, but from what we've heard, it's more effective as an mRNA as opposed to the AstraZeneca, which is a viral vector. So are we safer waiting for the Pfizer one, or are we safer taking the AstraZeneca? That's one. Number 2 is all to do with, how can I put it? I know someone has already asked, but I had COVID last April and I was really ill. I really was ill. So my question is, do I need to take the vaccine or do I have the antibodies? And are you checking to see if someone has the antibodies before you give them the vaccine, or even if they are positive with COVID before you vaccinate them? Because then you would present the situation where you said maybe someone had COVID before they were vaccinated, and then they have a problem where they present with live COVID and people say they had the vaccine and they got sick. So I had COVID last April. Should I take the vaccine or do I have the antibodies, and how do I know? So those are two questions. Thank you.
Thank you very much, Sylvia, for being brief and to the point. Can we now go on to Elizabeth? Elizabeth, may you also say your second name and where you're calling from before you ask, so that the doctor can take note of.
Okay. Hello. Good evening, everybody. This is Elizabeth Pearson, and I'm calling from London. Thank you for this session. I've only got a couple of questions, being that we had a very good sermon earlier on. Dr. Grace, if we believe that God created the human body and it is able to heal itself, can we utilize some more natural ways to combat the virus? And the other question is very simple, I think. Is it true that you can still get coronavirus and transmit it even after having any of the vaccinations? Thank you very much.
Okay, thank you, Elizabeth. Your question has been noted. Can we now move on to Rosemary? Rosemary, may you say your second name and where you're calling from? So,
yeah, my name is Rosemary Bagahi, and I'm calling from London, Enfield. And I'd like to thank Dr. Gloria for this opportunity and the choir and the session earlier of the Word of God. But my question is, although I'm happy to take the vaccine and I don't have any issues with it, however, to clarify for my friends who are skeptical, is that the vaccine is made using DNA from embryos, as we hear from, is it conspiracy theory? And these embryos, if the cells have got cancer, for example, and the vaccine is injected in you, that you could still carry the DNA of a cell which has got cancer and you could transfer it to your future generation. So is that true or not? That's my question, because the other two questions I had have already been asked. Thank you.
thank you very much, Rose, and for listening critically so that you don't repeat after what has been asked to answer already. The fourth person is Omumbeja Esther Nachimbugwe from Greenwich, London. Could you come on the floor and ask Omumbeja? Omumbeja Kwoli? Mumbeja Elizabeth? Sorry. Mumbeja Esther Nachimbugwe. You had a question to put forward. Okay, as we are waiting for Mumbeja, can we have the last person on the second set? Omuntu yenna ayagala okubuuza ekibuuzo asobola okwanmutinga.
Ssebo nze ninayo ekibuuzo.
Mwami Joel, yes, omukubiriza, yes.
Nadde sola kuwanika mukono engeri gye ndi admin nga tegukkiriza ogwange.
Okay, go on, yes.
Ssebo ninayo ebibuuzo, ebyange ebibuuzo biri bisatu. Ekibuuzo ekisooka kye mbadde mbuuza kibadde kya nti wano ze bayita anticorpin antibodies. Omuntu bw'azuulirwa nga alina antibodies era naye afuna vaccine. Ekibuuzo ekyokubiri kiri ku what is taking place in Uganda. The president told us it is a medicine. The ministers are saying it's a vaccine. Exactly what did they launch in Mulago? Is it a medicine? Is it a vaccine? And which one is that? Is it this one you're talking about, or Uganda has theirs? Ekyokusatu is about us who are non-British. We kindly request that you use the simple words. Most of them, GP, NS, those ones, please help us, the non-British, at least to simplify those ones so that we are part of what is taking place. Thank you.
Okay, tweyanza nnyo mwami Joel. The doctor has taken note of the questions. Ekisembayo, omuntu asembayo ku seeti eno, mwami mukulu wange Joel Sekiwu, by the way, mukulu wange oyo yasimbyeyo kitooke, obulwadde bwabadde bumutwala, twebaza Katonda. Sebo mwami Sekiwu buuza ekibuuzo, come forward. Mwami Sekiwu is in Rochdale, Manchester. Mwami Sekiwu kwoli?
He's on mute.
Mwami Sekiwu, unmute yourself and ask.
Thank you. Thank you very much, Dr. Kakati. I just want to, I probably know what this would be because I've been to consult. Naye mbadde nsaba obuulira abantu nti bw'oba olinga nze nga omaze okuyita mu bulwadde buno oba obulina, how long does it take to be allowed to have a vaccine? And basically they say waliwo that 90-day window. How do you know that you actually now fully recovered from it? That's my question. It's 4 weeks, okay. But I just want to know how you can get the 4 weeks out of the 90-day window. Thank you.
Okay. Omubejana Chimbugwe lost her voice. That's why she wouldn't come on to ask about them radde. Naya agamba nsaba kubuuza lwaki those vaccines to Africa are labeled quote, not to be distributed in Europe or USA, end of quote and question mark. Dr. Gloria agambye nti manufacturers never know which batch goes where. Nagamba, sorry, I lost my voice, but may you put that question forward to Dr. Gloria, which I've done. Katibana abooluganda tusabe Dr. Gloria addemu ebibuuzo ebyo ebitaano b'omukaaga, then n'oluvannyuma Dr. Matovu bw'aba supplementing, then batuwozeeyo obudde obulala tusobola okutwala ebibuuzo ebisembayo ebirala bitaano naye nga birabika ebya corona tebiggwaayo. Yes, Dr. Gloria, you have the floor. Thank you.
Okay, thank you again for those questions, which I will try to the best of my ability to answer. The first one was the lady who asked if she should wait for the Pfizer one because it's more effective. So the Pfizer vaccine, yes, they did say was 99.9%. They had that much efficacy after the second dose, and AstraZeneca said 90%. But I think they are it's lifelong protection. And wouldn't you much rather have 90% protection rather than
having nothing?
Than having nothing, exactly. Because if it's a supply issue, you might decide to wait and then not get it for 3 months. And in that waiting time, actually catch the COVID, end up in ITU, and, you know, hopefully nothing else worse happens. So I think, you know, the safest thing would be to take what you're offered, unless you have the contraindications. I would go for either option. Then the question about why we are not checking. No, I think you said, you've had antibodies, and why should you have a vaccine after that? So they've done tests, they've done antibody testing on people who've had this disease, and actually some of them do not have antibodies 3 months post the infection. After that, the antibodies have worn out of their system. But with this vaccine, your antibodies are lifelong, because you don't just form the antibodies, but you also form the memory cells that I'd said, so your reserve army. So any time that you get exposed to this virus in future, that those memory cells remember how to fight it and how to bring more soldiers to attack it. So infection will give you antibodies, yes, but that could only last 3 months. The vaccine will give you lifelong protection. Then Elizabeth, you asked about natural ways to combat the COVID-19. So yes, natural ways is what we are all doing right now with the social distancing, the sanitizing, taking our vitamin D, trying to keep healthy and fit. But we've seen cases where this has not worked. So rather than take a chance, I would go for the vaccine. And I strongly believe that God is the giver of all wisdom. I don't think that anything that man's come up with was out of his own power. So I believe that God's given the scientists this knowledge to form this vaccine to protect us, just like with medication. So I think taking the vaccine, having the vaccine doesn't suggest that you don't have faith in God and you don't trust that he would protect you. I think it's just working with, what God's enabled man to do through his wisdom. That's my take. And then Elizabeth, you also asked, can you still transmit the virus if you've had the vaccine? Yes, like I said, it's not 100%, it's 90%. We were saying there will be that 1 out of 10 chance that you might still catch the virus and pass it on to someone else, but it will be less severe. So it's not going to be the more aggressive form of the illness. Rosemary, you asked about the vaccine being DNA from embryos. So the data that's been released shows that the vaccine is made from RNA. So someone has asked me not to speak in British English. So RNA, so you either have DNA in your cell or you have the RNA, and the virus, it's RNA. So that's how it's made. This vaccine is made from a part of the cell of the COVID-19 virus, but it's a weakened part of it. It's not from embryos. That, as far as the research and data go to tell us. Joel, you've asked me if you have antibodies, do you need the vaccine? I think I've answered this. You will, the antibodies will only last you 3 months, and then, but the vaccine will give you lifelong protection because you have the memory cells. Okay. Then you asked a question about in Mulago, is it medicine or vaccine? I'm not too sure. I would pass this on to someone that's in Mulago, but what I know is that the vaccine is not yet in Uganda, so I'm assuming that you're referring to the treatment, the medication, rather than a vaccine. Then Mwami Sechiwu, you asked about, you said if you've had the infection, how long should you wait to receive the vaccine? So when you go in for your vaccine, we will ask you if you have any symptoms, cough, fever, loss of smell, anything that might suggest that you're actively infected with COVID. If you tick yes, then we're not giving you the vaccine at that point in time, would have to wait. And if you've had a positive COVID test or positive, if you've had a COVID infection within the last 4 weeks, then we will defer your vaccine. So it has to be done 4 weeks post-infection. And when you come in, we always try and find out if you've had a temperature or cough, anything to suggest that you actually are actively infected. And if you say no, then we go ahead and do the vaccine. But like I said, sometimes people haven't yet got the symptoms when they've had the vaccine. So it will appear as though they got the infection after the vaccine, but it's only because they were still in that window before symptoms can start to present. Then there was a question about vaccines that are being sent to Africa being labeled not for Europe. I don't know about this. I would assume it's a funding issue if they labeled them that way. Maybe the ones going to Africa have been, I'm guessing it's to do with funding. That's all I can guess. But I haven't seen the vaccines being sent to Africa as yet. I don't think any vaccines have been sent to Africa as yet. I know the Moderna one, there's quite a few countries that are trying to source that, but the AstraZeneca and the Pfizer, not yet in Africa. Yeah. The other thing I just want to say, to try and explain why I feel that if you get offered this vaccine, especially on the NHS where we're not even paying for it, is I don't know if you've heard about these private clubs in Mayfair for these wealthy people where they were paying £40,000 to get flown out to Dubai to get a COVID vaccine and stay there for 3 weeks and wait for their second dose and come back. So these are the wealthiest people, and they're willing to pay £40,000 for something that we might get for free. So it would be such a shame for us to turn it down when our turn comes to receive this. Because we need the vaccine to protect ourselves, but to protect everyone else around us and to stop this thing from spreading and ruining lives. Thank you.
Thank you very much, Dr. Gloria. May we have now Dr. Matovu oba nakyayongerako. Nkoze okubanyonnyola obulungi ku Dr. Matovu oyo, bamanyiganye bulungi ne Dr. Gloria. I think you are from the same professional community. But Dr. Matovu, Dr. Elijah Matovu is a Ugandan as well. Is a consultant microbiologist. I'm not a scientist myself. And is an infection control doctor. Kale naye alina obukugu mu ngeri eyo. Ekyatuyisizza abantu bano, because of the suspicion going on that is living within us. When we speak to these people who are part of us, who are Ugandan and working here in the system, we want them to look us in the eyes. Abakyalina okubuusabuusa. Tubabuulize ddala nammwe mutuliddemu olukwe. Dr. Matovu, anything you feel you want to supplement, you're welcome.
Sorry, yes, Mr. Kiaga, can I just ask one simple question?
Yes.
Please.
Yes, Mchala Elizabeth.
Yes, Gloria and Dr. Matovu, one simple question. We are having the flu jab more or less like once a year. Is it going to be exactly the same for the COVID vaccine? Is it going to be an annual thing to have every year? Thank you.
Okay. So with the flu vaccine, what happens is the flu vaccine targets the dominant strain of flu for that season, and it's always a different strain every year.
That is very true, yeah.
Yes. So with the COVID vaccine, it's meant to give you lifelong protection from the COVID virus. Now, I know there have been new strains, the Kent strain and Brazil and South Africa, but the current vaccines that we're using have been effective against those strains so far. So I don't think that we'll need to do one every year because it's lifelong immunity.
Thank you.
Okay.
Thank you very much. Dr. Matovu?
Thank you very much, Mr. Chiaga. To start is Tetubalidde Mlukwe, as you say. It's actually, this is from a professional angle. There are certain questions, say, around Pfizer and Oxford. The two vaccines are different. One is messenger RNA, which doesn't change. It's only a messenger and incites a reaction in your body to defend you. The other one is a protein that would incite the same reaction. So I wouldn't advise taking the different ones. Your body will respond to them differently. And the other thing is to be clear, they're not made from embryos. We've got primers for the different sort of, for the proteins as well as the messenger RNA that we're working from. And while we have the different trials, efficacy, safety, and of course how they respond in humans, hence the period of time that we do all these tests. So we know they are safe. Then there was a question about why vaccines are sent to Africa marked not to be used in the UK or US. This is purely funding, because what happens is, say, for example, we've got, the UK has ordered close to 600 vaccines. There's only 60 million of us. Some of us are children. They're not going to be vaccinated. There might be a remainder. The funding might be pulled from those, but the remaining bit will then be sent to sister countries in the Commonwealth, for example. But we're trying to avoid them being sold back to Europe or US as a business, because if your vaccine is, for argument's sake, is $100, and then you subsidize it and send it to Africa for $5. Somebody buys it in Africa and then brings it back to Europe and sells it for $50. That is why, if they've got the mark not to be sold in the US and the UK, it's purely a funding issue, so that they are kept in the areas they're supposed to. And then one would say, why are some countries ordering over and above their communities? It's because we want to have the capacity to vaccinate the people we've got with the best vaccines we've got, as far as supply and capacity can handle, and then be able to support countries where we've got interests. I mean, we've got interests as the British government supporting the Ugandan government, for example, for vaccination. And that will come for the future. And then there was a question about having vaccines when you've already had COVID. They're going to act as a booster, like Dr. Gloria said. You boost your immunity. The natural immunity you get from the disease is only short-lived. You will have the T cells forming and waiting for your vaccine. But if you get a vaccine, you're going to get the support to follow on from there. So it's worthwhile taking it on, and it's not a worry. And I would advise people to go for it. I hope that helps. Thank you very much.
Okay, thank you very much, Dr. Elijah Matovu. Now we are entering the last set.
Mr. Mayanja, apologies. I just have a point of clarification, please.
Yes.
A request to point of clarification. Do the doctors think, Dr. Gloria, don't you think it's a bold statement to say that this is a lifelong immunity, especially that you have confirmed that you can still get coronavirus and transmit it even after you've had the vaccination? So how does it then become a lifelong immunity like we do for tetanus and yellow fever and all things, things like that, which are also not lifelong anyway? They have an expiry date. So I just wanted a point of clarification on that issue, please.
Yeah, can we take it as the first question in the next set, and then we get 4 others? That way we save more time, isn't it? Yeah, the doctor has taken note of that. Yes, I have Michael. Michael, you raised your hand. Can you say your second name and where you best start so that you can put your question forward? Michael? Michael, you have the floor.
Ompulidde?
Tukulira bulungi sewo.
Yeah, amanya Michael Katabalwa. nga nsinzidde wano mu Stockholm, Sweden. Nyabo webale nnyo okubanga okuweereza pulogulaamu eno y'okubanga tumanya ku bikwatagana n'okwemesebwa. Ebibuuzo niyinza okuba n'ebibuuzo bibiri ebiri simple nnyo oba biri simple oba biri complicated. Kaakati ekisooka kiri nti twawulira nti vaccination yasooka ku ssenyiga ono yasookawo bamuyita Spanish influenza like that. Abantu bafuna side effects. Kaakati bw'obadde onnyonnyola ku gundi ku vaccination eno onnyonnyodde gundi short term effects. Naye waliwo eziyinza okujja mu future eyo katugambe wayisewo ebbanga. Kati ng'eyo gundi vaccination ebagamba nti abantu balinga katugambe omuntu aba atambula n'asumagira. So kakati eno gundi COVID gundi vaccine eno yeeri etya. Ekibuuzo ekyokubiri kikwatagana gundi kwati COVID yazzewo ono bagamba variant. Vaccine ekolera ku COVID variant kyetwagala okumanya ekyo nnyo.
Webale nnyo mukulu Michael. The next person to ask is Rose Nambago. Just tell us where you're based and then ask your question, please.
Hello, sir. Mwebale kutegeka Zoom eno. My question is to both doctors. Vaccine neddagala eddala lyonna lye tumanyi. Nze siri musawo. Sorry. Nze bampita Rose Nambago, ndi wano London. Nkola mu healthcare naye siri musawo. Kakati ekibuzo kyange kiri nti amadagala amalala gonna usually gali tested over a long period of time, myaka ga 10 plus before they actually use these drugs to human beings. Kati my worry is, is this a mass trial? Bali mukulu tryingirako kubanga gundi COVID tamazeewo banga dene. So it's just worrying nti tetumanyi kiyinza ku happeninga to our bodies in the long run. Nabo bennyini ndowooza abazudde eddagala tebakimanyi. So could they enlighten us? Waliwo tests zonna ze baakoze ziraga nti tetujja kufuna long term effects. Thank you.
Okay, webale nnyo Rose Nambago. Waliwo awandiise wano ekibuuzo kigenda kale abasawo tubalina webale. Naye ndowooza kino okusinza bwe bakiwandiise mu kirayika kijja gowa Pastor Lincoln. Pastor Lincoln tukyali naye. Bwana Pastor Lincoln tukyali naawe ssebo. Waliwo abuuzizza wano ow'Oluganda omulokole. Abuuzizza ndowooza ojja kiddamu. Ye alowooza nti ffe ng'abalokole oba abakkiriza newankubadde nga ffenna observation ye eraga nti abalokole tulabika tukulembedde nnyo mu kubeera nga tubuusabuusa twekengera eddagala lino. Ndowooza y'engeri gyakibuuzizzaamu naye ndowooza okitegedde nti bikwataganira wa science ono akwataganira wa n'okukkiriza okukkiriza mu Katonda n'okubeera nti Katonda ajja tukuuma obulamu obutafa. Ekibuuzo bwatyo bwakibuuzo tekitegeereka bulungi naye ndowooza pastor kitegedde. Kibadde kiwandiike wano ssebo. Ate ndowooza gwe engeri gy'oli mu spiritual world ate nga neeno ewaffe otutegeera. Ndowooza oli in position okuddamu ekibuuzo ekyo. Kiddemu tuleke tugende eri abasawo.
Kale banange, the truth is this, whatever is going on, omanyi ffe abamu tuli beebafu. We are at a cutting edge of business opportunity. Ekyo mukitegeera. Bino ebidde ebiseera bya business. AstraZeneca is a pharmacy company, but it's a business. Yeah, eyo tetuliyo kati leveddako efuka information. So ekyatwononera ng'abalokole oba abakristaayo oba baani is eri Americans abatusooka okusoma business. Bamanya when there's a pandemic which is global, this is when you boost your Facebook, this is when you boost your YouTube, this is when you boost your Twitter. This is the time to get attention to your website. So unfortunately, some people, I don't know whether you watch some of the videos, abagundi abantu abamuze bakola, ne bringing in Antichrist, ne bringing in 666, ne bringing in DNA modification, byonna ne babigatta mu Bible, nga bagamba nti bannange mwategedde bakolera that documentary. It was filmed professionally. There was a lady whose field in medicine is not genetics. It's not even infectious diseases. She has she's a doctor in another field altogether. Gweba frontinga. Nalyoka nnyonnyola nga abasajja bwe bazza okuleeta stand. Bamukube mu musaayi gwo gwennyini. Obenka, you no longer have a capacity to believe God because they have changed your DNA. Ne bakola campaign nene ne circulating a video in the first wave. Katifa abamu bana, I can't say ndi byonna mbimanyi, but some of this stuff is actually embarrassing. It is embarrassing to be associated with it because it doesn't make any medical sense. There is no way that your DNA can be changed. Nze ngeyasoma biology nentuukako e Makerere nenkola ka degree kange mu agriculture. I can tell you there is no way you can change a person's DNA by engrafting a bit of DNA through a needle. You cannot. You need to inject that DNA at embryo stage to change a person's DNA. Biswaza okwogera tibakukyusiza DNA through an injection. Then ogamba you can insert a microchip through an injection. Because microchips technology has not got to that level yet. It's just people are trying to drive traffic to their websites and they will be paid by YouTube. Because YouTube pays you by how many people come to your website. So ebintu ebimu tulina obitunuulira tulabe nti tebirina mazima. Just 666 as a concept in Revelation is people will be asked to deny Christ, otherwise they are not allowed to buy or sell. It has got nothing to do with DNA. It is about you reversing your confession, otherwise you are not allowed to buy or sell. That is 666. It has nothing to do with genetics. It has nothing to do with injections. Osoka kwatula neganye Yesu ne balyoka bakutta kubanga tojja kugula kintu kyonna nga tomweganye. So it has got nothing to do with what has been popularized. Instead, people have sold. Waliwo n'omukyala yawandiika ekitabo n'afuna millions because people are buying the book. These are people who understand market forces and they know global pandemics are a perfect opportunity to drive traffic to your website. Kamalize ne kino. When you go on Google, no typing ebintu no researching, tokoze research. Research is not the internet. Abantu bajja kugamba Bill Gates yakoze kiti. Nabisomye byonna, nasomye article 10 wazisanzeewa ku Google. Google is not a research base. You need to research the research of the research that you find in Google. You need to go to original books. Otherwise, you'll fall in the hands of conspiracy theorists and people who don't know what they are talking about. Please do not think that because you watched a video, wakoze research, wagenze ku internet, nolaba document. Guys are trying to find attention and they are being paid for lies and fake news. Kankoma mukulu ndoza njogedde kimala.
So, tuyanza nnyo pastor, akudira mulimba taluwoomya. Ekibuuzo kitekedde bulungi era ssebo bali kukyanukula okuva mu ange eyo. Ate kati katudde ku basawo baffe nga tuwunzika kubanga waliwo omukyala wano abuuzizza. Okay, kandaba bawanise emikono. Susan B yaddako then to one more person tumalize tugende mu session esemba y'aba doctors. Susan B, your second name and where you're calling from?
I'm Susan. Yeah, I'm Susan Mujambarazi. I'm in Ipswich. Yeah, thank you very much for your time and the explanations that have been given so far. I'm someone who likes research and I like to look into things. I'm somebody who does not believe everything I see in the media. I go away and dig deeper, and I look information I find. I make sure I look at the credentials of people saying this and counteract with other arguments until I am convinced. So my main concern about the vaccine is that it's being pushed or promoted by people such as Bill Gates, whose father is the head of the Planned Parenthood in America. You all know about that, killing babies. Bill Gates himself has expressed a desire to reduce the world's population by 90%. That's actually on record, to look into that as well. It's factual. So when you have someone whose dad is a baby killer, harvesting organs and promoting that, the molarity of that, and who the person who himself has expressed interest to reduce the world's population, pushing this agenda, for me, that's a big red flag right there. That's my biggest concern. Secondly,
okay.
I know, just one more question.
Before I ask the second question, just for clarification on that first question, is your research from Google or is it from?
No, I've been to university. I know about research. I go, forget the mainstream media and whatnot. I've got my sources. I can share information if you want. This is credible.
So you got your own sources, isn't
it? That are certified, that I know have been looked into by people who have the right credentials, people who have researched, who have the right information. So I don't go Google. I don't use Google, by the way, and I don't. Yeah. So
okay, that's okay. That's okay. You can go to the second question.
So my second question is that I really want to understand from the doctors: is there really a need at all for the vaccine? I know that yes, the disease is here. Yes, it's affecting us. Yes, it's killing us. But you don't really need to have to inject people unless you have to. COVID has a mortality rate of less than 1%. And actually, statistics show that the common cold has killed more people than COVID. So that's my concern. I wish my mind, so far they argue the information we have had, I know the doctor is talking about, but really I'm not convinced. I'm really not convinced. I've had some really bold statements that are contradicting the information that is out there. I've had bold statements, it covers you for life. No, when actually the first thing they tell you is you will, no guarantees you won't catch the disease, you catch it and it can actually kill you. You won't say, oh, I have had this, I've been given guarantee. So I'm hearing bold statements, and I think people should go and carry out their own research and convince yourself, go out and research and look into it and make your own decision.
Thank you very much, Susan, for the two questions. I'm giving chance to just one last person. And the last question, and then we shall wrap up with one more question. With the doctor. There's somebody who asked in the chat room. Excuse me. Yeah, Mr. Oriema asked, can a mother touch her newborn baby if she has COVID-19? Okay, with that last set of questions, can we have a response from the doctors? And then we shall call it a day. I understand that this topic is very broad. Yeah. You may have observed everybody, most of the people are passionate about their positions. Most of them believe what they know or what they have found out through the internet or through Google or through their research. But the reason why we come together as a community, because research has been conducted, and whereas they are saying that it is Black, Asian, and minority ethnic, the percentage of hesitancy amongst the Black community is still the highest. The latest research was 72% of the Black people. So that's why we thought it was worthwhile to bring some of our own experts who are at the forefront of this mass vaccination to speak to us, because normally messages are received differently depending on the source. I remember some time back, of course, despite the fact that the polio vaccination has been here for ages, but until recently, there was some resistance in Uganda, and the government at one time had to involve cultural leaders, and the cultural leaders, because they are closer to the people, to instill that confidence. So we thought when we speak to our own people, Ugandans, who are medical professions, who are participating in the rollout of the vaccination, we can get that perspective. And information is power and knowledge. So, yes, Pastor.
Sorry, I need to leave. Permit me to give a final word because I need to run.
Okay.
Yeah, but I feel what I want to say is important. Banange, with all these conspiracy theories, I want to say this as a reasoning point before I go. If Bill Gates is behind the COVID vaccines, which one is he behind? That's a question I leave floating. Which one is he behind? I would like to know. Is he behind all of them? Secondly, if his plan is to reduce global population by 90, he has started in style, because we have just vaccinated all our medical professionals in all the leading nations of the world. In America, in Britain, in France, we have basically killed off the medical practitioners of the world. Yeah, that is Bill Gates' program. As we stand, all the doctors are dead, all the nurses are dead. What a strategy. What a way to reduce global population. The Queen is dead. I personally think we need to, after we've done the research, we need to sit back and think and say, does it make any sense? To me, it does not make any sense. Decided that you want to kill off a big proportion of the earth, you kill your doctors. Yeah. And then you begin to fight over the medicine in Europe, because you're not even ready to send it to Africa. You are fighting over it in Europe because it's not enough. I've never heard of fighting over a poison. If anyone in Europe, if anyone should know Bill Gates' program, the Europeans should know. And they are fighting over the vaccine. Keep it here, not even to send it to Africa. That's my final offering, friends. When you reason it, some of this stuff doesn't make sense at all. God bless you, friends, as we continue the conversation.
Thank you very much.
Saba mukulu Chiaga.
Bana tugenda yes.
Mukulu Chiaga, obadde oyinawo ensonga gye yogeddeko. Nsaba obana just alleviate our
Bana yanye noja wano omuntu aleseeko goal. Ani oyo?
Aliko email. Alina ebintu ebikubungotana.
Email, yes, email. Kale mujjeeko.
Sebo mwami Chiaga. The reason lwaki BEM, Black, Asian, and minority ethnic people lwaki tulabika mu nnamba ezo as very high is simply because abaddugavu, Asians, and almost all ethnic minorities twajja muno as economic refugees, and most of us are working at the front line. basawo, medical practitioners, HCAs, mu buli mbeera ogenda mu Aldi okugula emmere, mu Tesco wa omuntu ayimiridde ku luggi muki, muddugavu, muyindi, oba muzungu ava mu Eastern Europe. Those are all ethnic minorities. The reasons why our numbers are high is because we are the front line. And that is the truth. And therefore, it is not doctored, but it also works against us. Our numbers are high and they are showing up as I and so to know whether as people on the front line, should we continue to hide our heads under the sand, or should we listen to Emisomonga, and hope that tujja kubeerawo mu nsi ensuubize nga COVID naye akendedde. Nze guno omusobo ngweyanzizza nnyo kubanga mbadde omu ku abo abakyasikattira, naye kati I'll protect my community. After all, no one lives here alive.
Okay. Kati bane kati ndoza tukanya nti tuwe ba dokita omukisa bawunzike. Mpozi nanga akasemberayo ddala. Waliwo abantu abafunye omukisa okwegema naye nga bakyekengera ne batagenda, ate ne wabeerawo abanoonya okwegemesa nga tebannaba kubeera kuyitibwa. Nkozi badokita kye baba batunamu ng'ekibuuzo ekisembayo nti waliwo scenario nti bakuyise bakugeme, oluusi oli musawo. Sinaba kulaba dokita naye bannansi, manyi bannansi abamu abakola ki, abeekengera. Kakati okyagenda mu ddwaliro okukola ku balwadde oba mu care home, ate okyekengera eddagala otya okwegemesa. Mu mbeera eyo dokita ndoza mukyogereko, bano ba clients b'okolako oba tocompromisinga bulamu bwabwe singa osobola okutambuza obulwadde mu bbanga eryo lye weekengera n'obasiiga, ate abamu ne babeera nga balina underlying issues, oluusi bambi ne bafa ne balusulamu akaba, newankubadde gwe oyinza okuba nga oyinza obutafa. Nakyo is a school for thought, but the doctors can also have a commentary in their concluding remarks. Without much ado, may I invite back Dr. Gloria to give her closing responses and the questions, and then Dr. Matovu, bana endowooza tumalirize. Tujja ndowooza mulabye abantu bakyayagala, so tujja kufunayo olunaku lulamba bannaye, tutandike essaawa 2 naye mbadde mbasaba tuwunzike.
Okay. So just to say, this last set of questions were all things that we'd already discussed. We looked at the side effects already, and I did address that the Pfizer and AstraZeneca do protect from the new variants as well. And we talked about the short trial period. I explained how it was all done at the same time rather than sequential. And the issue of Bill Gates, I think Musumba, what's his name, Lincoln, did a great job.
Not at all. We could debate this all day. What I would like to say, sorry to interrupt.
Susan.
Yeah.
Susan, because it's opinions.
I could have all day. I've got so much more to say. But however,
that's your opinion. Give us a chance.
Yeah, can you give the doctors a chance, please? You have put forward your opinion. Yeah.
Okay.
Yeah, it's time to respond, and then we shall continue the debate after the show. Yes.
Yeah, so in a nutshell, that's all I had to say about the COVID vaccine, how it works, what the research has shown. We are all allowed to have our different opinions. We can go online and try and find the research papers that that would explain it further. There's no one that's going to be forced to have the vaccine. So if anyone doesn't feel safe having it, then you can always opt out, which is good. But thank you so much, everyone, for your thoughts. And I do hope that you have a better understanding of how the vaccine works. And thank you so much for the organizers. Thank you for organizing a good talk, which I think has been helpful.
Okay. Dr. Gloria.
Thank you, Gloria.
Some closing remarks. Any comments, any questions that have been left hanging? Just
thank you, Gloria.
I have a comment.
And then we shall have a comment after, yes.
Well, thank you very much, Mr. Chiaga, and all those that have attended. It's worthwhile that people that have opinions or questions to be aired. I wish we could have more of these, or a certain time, a more lengthy period to discuss this, because if one has questions that they're not quite happy with, they are going to have problems getting the vaccine, which then is going to lengthen the issues we've got. Now, there are all sorts of percentages of how much COVID causes and how do you compare that to flu or malaria or anything else. The actual issue is that where we stand today, we've had a year of poor economic returns, illnesses, deaths, and lots of things. We have all been affected. It's not something we can sit back because the statistics point towards flu being more effective, having bigger death numbers than COVID. Because we've now got issues that are going to come, like the education of the children, their psychology, the economics of it all. We've got to deal with that. And so if we've got a vaccine that works for us, that is safe for us, that us, in the medical profession, not just research, because we're doing the recovery trial, we're doing the REACT trial, we're doing lots of trials right here, and we're undertaking them. We're actually working towards a safer community. Because even if you're vaccinated and say, well, you can still spread it, you're not going to become ill, which means that then the hospital, you don't have to occupy a hospital bed. Somebody who is actually ill is going to have to do that. It only means that if you've got it on your hands or any fomites in your house, it's you're going to spread it. But if you're vaccinated and build on the herd immunity, that's going to lower the numbers of what is out there, what is spreading in the community. And that is helpful a lot. That's why I would say, please get vaccinated. Please stay safe. Please talk to your peers about this, have these discussions. And Facebook, Twitter research is actually not research. Try and read peer-reviewed papers, if you may. Ask some of us what our opinions are, and then look into things and compare things. And then, people like Bill Gates and the rest of it, they've actually put in a lot of their money into some of these research bits, not to get rid of the communities from who actually support their businesses.
Oh, goodness me. You people are making me mad. It is unproven. This is new. It is experimental. Nobody knows the long-term effect. You doctors are failing in your duty of care if you're convincing people. Nobody knows the long-term effect. This is all experimental. The doctor has also said they are still going, something could erupt. Stop leaving
Madam.
on. Let the people do their own research.
Can you please keep your comments to yourself?
Sorry, madam, I understand let's not be emotive about this issue. The research that has gone into COVID, and as the coronavirus is, as we are, we've been doing this since 2003. We've been looking into the trials. So the speed of it developing now is because there's an urgency. You know what I mean? There is an urgency. If you've been trying to do something in the background, grow in your garden, and then all of a sudden you've got, a dry summer, then you have to look into ways how to support that. And that's what is being done. So nobody's out there to get you, right? And that's why we've actually gotten the leaders, the world leaders, to actually have these vaccines, because being skeptical is not a problem. It's actually a good thing, because then answers can be developed. Is that okay? I mean, I might be here for the whole day, but the truth is that we really need to look into this, because we've got to move on here. And when you talk about the long-term effects, we've had a year of this. Say, for example, the studies that we've got, Moderna, Pfizer, and AstraZeneca, we've been running since March, through June, September. When we have the variants coming in around September, those we've been looking back at them. These are papers that, when they send out papers to advise the government. So you send papers up, say for the UK, I'll speak for the UK because I know what we've done. They send them to the regions, and then they send them to SARG, and then they send them to different royal colleges, and people come back with their comments with what the numbers look like. And that's what we then put out to the public. And then, so for example, my parents had these vaccines last week, and it was because they said, are you sure about this? We went through the numbers. They're public health professionals. And they say, fine, we're up for it. And they did. They haven't had side effects, not like everybody does. It's not doesn't mean it doesn't work. It actually is protecting them. So please do take this information on. I hope that helps, but I'm happy to help with more questions if any. Thank you very much.
Thank you, doctors, and sorry for the attitude of the last speaker.
Thank you very
Yes,
much.
indeed. Thank you, doctors. And really sorry for the last speaker. I think sometimes when it's something that is so close to one's heart, you get passionate, and being Black, sometimes we are not, we don't know how to place that emotion. But I really thank you for reaching out to our community, for sharing that.